There's so much thought, but so little is said. Hearing someone ask, "How are you?" just seems to close the doors to opening up when it already seems as if the walls of your world are locking in, ready to cave at any time. And you feel like no one understands you because hearing the highs and hellos, the "what's going on, Virgin," or the "sis, you seem out of it," just looks like opportunities for you to burden the ones you love by unpacking the baggage of what's going on with you. And it seems like you always one "I'm not okay, okay" away from letting anyone who asks in on what's going on, but you always stop yourself by saying, "I don't think they understand. I don't think that they're ready to see me like this. I don't think they'll know how to respond." So you say nothing and keep it
There is
to
so
yourself.
much taught, but so little is said. We lose more brothers and sisters in Trinidad and Tobago to this. And each loss shakes us to the core. We wonder it happened and why they said nothing. Why no one thought to seek help? We forget that stereotypes and stigmas usually prevent people from seeking help. Or sadly, they seek help and no one knows how to help them because they don't know the signs. The people they reach out to don't understand how to respond. We lose brothers and sisters to suicide who feel isolated and alone, experience a lack of support. They fear rejection. They feel hopelessness and ambivalence. They experience mental illnesses. We lose more brothers and sisters to suicide because domestic and gender based violence is present. Family disputes, substance abuse, sexual abuse, child abuse, verbal, emotional, mental abuse, or even stress, trauma, and PTSD.
But they don't tell you the facts. The World Health Organization states that Trinidad and Tobago ranks third in the Caribbean of the highest suicide rates. Also, according to recent articles, as well as a local psychologist at the University of the West Indies, mental health disorders only account for 5% of the amount of suicide rates in the country, while domestic disputes and domestic violence accounts for 75%. It was also stated that bullying, harassment, loneliness, and isolation are also key factors in Trinidad and Tobago that causes persons to have suicidal thoughts and tendencies. According to a recent article published 3 years ago, it stated that students in their final year experience high levels of stress, burnout, and depressive symptoms, which then lead to suicidal thoughts and tendencies. Then, when those suicidal thoughts and tendencies tend to worsen when students experience a lot of emotional stress, lack of emotional support, and when they feel left alone and feel like they don't have any control over their lives. These facts and many sources can be found on many newsletter websites such as 868 Word, as well as many local journal articles on suicide, stress, burnout, and mental health
There's so much
disorders.
thought and so much to learn. How can we help our brothers and sisters when they feel like this? Show support. Avoid being judgmental or dismissive of what your friend is feeling. Speak from the heart. There's no right or wrong things you can say if you're speaking out of love and concern. Just be yourself. Show that you care by talking to them, holding them while they cry, or whatever else is necessary. Research has shown that acknowledging what people are experiencing may help them process their thoughts and may reduce their suicidal thoughts. Listen. A suicidal person is usually carrying some burden that they feel that they can't handle anymore. Offer to listen as they vent their feelings of despair, anger, and loneliness. Sometimes this is just enough to lighten the load for them to carry on. Validate and show openness. Be sympathetic, non-judgmental, patient, calm, and accepting. The person will pick up on your attitude and begin to reciprocate your openness. Confirm suicidal thoughts. Don't be afraid to ask, have you ever thought about that? Or do you think about suicide? Studies have shown that asking at-risk friends and family members if they're thinking about suicide does not increase suicidal thoughts. You are not putting ideas in their head by asking. Instead, this will give you valuable information on how to proceed and help. Keep them talking. Talking will allow them to reduce the emotional burden that they're carrying and give them time to calm down. The longer you keep them talking, the more you can take the edge off of their desperation. As their momentum winds down, it is harder for them to act on their feelings. Avoid trying to solve the problem. Try not to offer quick solutions or belittle the person's feelings. How big they perceive the problem to be and how much they're hurting over it is what counts. Rational arguments do little good to persuade a person when they're in this state of mind. Instead, offer your empathy and compassion for what they are feeling without making any judgments about whether or not they should feel that way.
There is so much thought and so much to be done. Your emotions during this time are valid. You may be 1 in 7 billion, but you are experiencing your unique version of this pandemic. If being at home or being needed at work or even exposing yourself to the news has been negatively affecting you, then please know that there are people and organizations who care about you and your mental health. Such services accessible to everyone in Trinidad and Tobago include the Domestic Violence Hotline at 800-SAVE, Childline Trinidad and Tobago at 800-4321, and Lifeline TT at 800-5588. In different areas of Trinidad and Tobago, there are also mental health facilities that you can utilize, such as in the Southwest region, San Fernando Community Mental Health Center. In the North Central region, Tacarigua Psychiatric Outpatient Clinic, and in Tobago, Psychotherapy and Counseling at Sunstone Boulevard. You can visit the website health.gov.tt for more information on mental health organizations close to your area. Additionally, you could contact the CIT, the Crisis Intervention Team of Trinidad and Tobago Association of Psychologists, TTAP. According to them, if you are burdened with persistent and overwhelming emotions like sadness, depression, and anxiety, you can call the members on these numbers at their respective times, and they will listen to you. We, the Peer Counselling Association, are a student mental health organization in Trinidad and Tobago. We offer help to students of the University of the West Indies who may be in a negative mental space and who reach out for our support. You are not alone. Please know this, and know that you deserve peace of mind and the chance to voice your thoughts. Please utilize these resources and know that you will be okay. We are here for you.